start.
Hi, this is Dr. Lavarge Sunder, chiropractor here at Sigil Clinic in Brampton, Ontario. Today's topic is in sciatica, so I'll be going over what the main causes are, the main treatment options, signs and symptoms. At the end, I'll go over 3 exercises that you guys can do at home that helps with the pain associated with sciatica, and then 2 acupressure points that you can do at home as well. So first off, sciatica is basically a pinching of the sciatic nerve. And it's a nerve that starts in the low back and it goes into each of the legs, goes all the way down to the foot. So depending on where it's pinched, you get different signs and symptoms. We have a lot of patients that come through the door that have sciatica, and so it's very important to educate everyone at home on what this feels like and what to do to prevent it and help with the pain with it. So the main 4 causes of sciatica are lumbar disc herniation, degenerative disc disease or arthritis, as is known as well, spinal stenosis, and spondylolisthesis. So these are the main 4 causes of sciatica. And the signs and symptoms are basically you get a sharp pain, numbness or tingling anywhere from the butt area all the way down to the leg and to the foot. There might be weakness associated with the leg or foot, so it's hard to kind of move the foot and leg. You feel weak on one side than the other. It's worse when sitting down, and you can also get a numbness feeling and just tight muscles in the butt area, and you also can get it's rare to have it in both legs. It's usually just in one leg. Okay, so treatment options are for sure physiotherapy, chiropractic of course. We look at the spine alignment because the nerve does come from the low back. So if there's anything wrong with the lumbar vertebra, like I mentioned with spinal stenosis or spondylolisthesis, so we can kind of look at the low back area and try to fix the alignment there. Homeopathy, of course, fixes the internal damage caused by sciatica, and together homeopathy, chiropractic, it gives a great combination effect for this. And then, of course, not going to leave out traditional medication for acute relief. It is pretty beneficial. And for longer lasting, to get to the root cause, though, it's more beneficial to go the alternative route. So that's for treatment options. So now I'll go through 3 exercises that we can do at home that help with the pain with sciatica. So the first one is called bird dog. So the reason it's called that is because you're on your floors like this. So you can do this either on a carpet or on a table like this or the floor, anything comfortable. So what you're going to do is basically be on your knees and hands like this. And you're going to have one arm like this and then the opposite leg like this. And what you're working on is you're working on your stomach and you're trying to keep your back as straight as possible. And for beginning wise, you want to hold for about 5 seconds. Okay, and then you drop it down, and then you're going to do the other side. So like that. Okay, and the reason this helps with sciatica is because you're actually working on the stomach and the back. And this helps kind of to prevent, to get the muscles stronger. So this is a great exercise to do. And then what you can do 10 on each side. And once you get better at that, you can hold it for longer. Or you can even start doing things like this. So instead of going straight, you start going sideways. And that actually works a lot more on like the other stomach muscles. And it kind of challenges your balance to it as well. So as you can see, I'm working my leg. I'm working like a lot of stuff in this one simple exercise. Okay, so that's the bird dog. The next one is called cat camel, because you look like a cat and a camel. So you're gonna basically extend your back like this and your chest out. Okay, you're gonna take a deep breath in, and then you're gonna roll down your back like this, and then come back out. And this is also traditional in yoga as well, and it kind of helps floss the low back and the nerve in the sciatic nerve as well. So you're just kind of do 10 of these, and then really extend the back like that, and you'll feel the tension like right about there. So that's the second exercise. And the third one is you're going to be on your back here. Okay, so you can have a pillow under your head if you want. It's not a problem. So you're just going to have your feet on the floor, hands to the side. And then what you're going to do is you're going to raise both your legs off the table. So from here. So you're just going to take a deep breath in, and then raise your stomach up and your butt up, and you're going to squeeze the butt, and then you're gonna hold for 5 seconds, and then relax. And then what we're trying to do is we're trying to strengthen the muscle here. The nerve goes in through here, so that's why we're working on this this muscle here. So you can do it again. So hold for 5 seconds, like that. And then once you get better at this, you can do 10 of them every day. And once it becomes easier, you can start doing things like this, where you hold the leg and parallel to the other one, the thigh. And then you're just gonna, again, squeeze, and it gets harder because now you're putting more pressure on this leg. And then drop it down. And then you can do it again. And that's called glute bridge, it's called, because you're making like a bridge. And yeah, those are the 3 exercises. And with anything in terms of, if anyone has sciatica, when you're sleeping, it's good to have a pillow between the knees like this. You're sleeping on your side, or if you're lying down your back, you can have the pillow on your low back. So it's always beneficial to have that. And okay, so the last thing is the acupressure points. So there's 2 main ones. You can either do it lying down or sitting up. You should do it 5 times a day. That's most commonly required. So what you're gonna do is basically take your 2 fingers, side of the hips, right here, right where the hips start, and you're just gonna press. So that's the 1 acupressure point, and hold for 5 seconds. And then let go, and then you can do it another time, and do it 5 times. And then that's one of them. And the other one is the side of the leg here, right where the knee is on the outside. And you're gonna press, same thing, 5 seconds, and then let go. And then those are the 2 acupressure points that help for the pain with sciatica. So that's the end of the segment. If you have any more questions, feel free to call us and contact any of the doctors in the clinic, and we'll be glad to help you. Thank you. See you next.